Okay guys, welcome to part 2 of our rules and regulations that govern the pharmacy practice. So now we'll be discussing the Medicines Act. So the Medicines Act was introduced in 1965 and it became known as the Medicine and Related Substance Act of 101 of 1965. Unlike the Pharmacy Act that regulates the pharmacy practice, the primary role of this act is to regulate the registration, control and sales of medicines and related substances. The regulatory body for this act is SAHPRA, which is South African Health Product Regulatory Authority, previously known as MCC, the Medicines Control Council. So what is the role of SAHPRA? So I will just quote section 2A of the Medicines and Related Substance Act. So section 2A says objects of the authority. The objects of the authority are to provide for the monitoring. So that means they monitor all the medication that comes in or out of the country. Evaluation. So before the medicine is deemed fit for human or animal consumption, it has to be evaluated by SAHPRA. Regulation. So they are also responsible for regulating medicine within the country. Investigating. So anything related to medicine, they have to if there's anything that is wrong related to medication, then they can investigate that. Inspection. So every institution or every establishment that is gonna be selling or producing medication has to be inspected and approved by SAHPRA. Registration. As I said, all medication has to be registered and approved by SAHPRA before they can be deemed fit for human consumption. And control of medicine, scheduled substances, clinical trials and medical devices, IUDs and related matter in the public interest. So that doesn't include only medicine, anything that can be used as a medical device as well. So they are responsible for regulating that as well. So because the pharmacies deal primarily with medication, this law is very important because it is basically the one that deals mostly with the scheduling. It detects which medication can be sold over the counter and which medication can be sold on prescription. It is the one that tells us what a prescription should look like. This law does not only apply to pharmacy professionals, it also applies to everyone working with medications. It can be doctors, dentists, vets, your nurses, your paramedics, you name them. Breaking this law may lead to imprisonment and the pharmacy losing their operating license. Notice in this one I did not talk about downgrading or getting fined. Breaking this act basically means the pharmacy is operating illegally. The Medicines Act is the one that puts limits on the medication you can get. For example, it is this act that detects that 24 tablets of paracetamol or Panadol, you can get them on the floor and the quantities above that can be bought over the counter. We will talk more about scheduling very soon. So SAHPRA, the regulatory authority of this act, is the one that is responsible for registration of all medicines that are coming into the country. So medicines that bypass these regulations are deemed illegally because they do not meet our health standards. For example, one of the most common products that I've seen being used that is not registered within the country is Betasol. Betasol is not registered in South Africa, so people get it from unauthorized dealers. So if anything happens to you while using this product, no one can be held accountable for it. They are also responsible for pricing of scheduled substances. So yes guys, medicines are regulated, prices of medicines are regulated. So pharmacies cannot just price as they please. they have to comply with the pricing regulations. So pricing more than what is imposed then can lead to a closure of a pharmacy because you're basically exploiting people. Remember when I told you that health is a basic need in South Africa? This is one of the ways that the government trying to make sure that everyone can access quality health. The Medicines Act is one that affects you as a patient or a consumer the most, while the Pharmacy Act affects mostly the pharmacy professionals and the pharmacies. So in my previous video, I referred mostly to the Pharmacy Act, that because I was still dealing with the pharmacy professionals, dealing with the scope of practice, so I had to refer to the Pharmacy Act. But on my next video, I'll be dealing mostly with the Medicines Act, because we'll be dealing mostly with medication and all that, the usage and all that. So I'll be mostly coding the Medicines Act. Now let's quickly discuss the new kid on the block, the POPI Act. Yo guys, this act is showing every business flames. It's a new act, but it's already showing businesses flames. So the law has been in South Africa for just 4 years, but it has caused a massive shift on how the farmers or how our business conduct themselves. So in full, this law is called the Protection of Personal Information Act. It was introduced in South Africa in 2013, but it came into full effect in 2021. So this law requires that every business or establishment to protect the personal information of every consumer. So that means companies are not allowed to share your personal information, like your address, your name, your ID, your cell phone number, your policy number. In the case of pharmacy, they are not allowed to share your medical history with anyone. So this law protects the individuals. It does not it doesn't say anything about married couples. This means you cannot share any personal information of one spouse to another without their consent. Yeah, it is quite tricky. So we are from an era without this act, where one spouse could other one's medication without any issue, to an era where you need a consent to collect your wife's medication. Even for a kid, for that matter, if your child is over 18, then you will need their consent to collect their medication. Crazy, right? So this is why now the pharmacies are starting to require ID or proof of identification. They will also require consent from everyone you are purchasing medication from. I know most people are always complaining when we are asking for their IDs or consent. A company can be fined up to 10 million rands for POPI Act violation. Let me make one example of a POPI Act violation that we can encounter in the pharmacy. Let's say a teenager or a 12-year-old came to your pharmacy and buys morning after pills, as the law allows them to buy the morning after pill without any parent's consent. Then a pharmacy personnel as a pharmacy personnel, you decide to share that information with one of the children's parents for whatever reason. Then they have a right to sue the company for POPI Act violation. So this act is not a joke. When a pharmacy personnel asks for your proof of identity, they're not trying to be funny or hard on you, but they're also trying to protect themselves, because a violation of this act might cost them their job. So I have seen a lot of POPI Act violation cases at work, but I won't be sharing that any of those stories with you, because they may put the company in danger. The other reason for us to require your ID is to protect you, especially those that are on medical aid. There is too much fraud going around. To be honest with you guys, I do understand this law and I totally agree with it. So I think it will do more good than bad. So in conclusion, the Pharmacy Act is to regulate the pharmacy practice. Medicines Act is responsible for regulating registration, controls, and sales of medicines and other medical devices. Then the POPI Act is responsible for protecting individuals' personal information. Then there are other laws that regulate the pharmacy practice, but these are the most important one that affects you. There might also be SOPs and other internal laws that help to enforce the above laws. But in my video, I will mostly be referring to the two first act I've discussed, the Pharmacy Act and the Medicines Act. And I might also include the rules and regulations like the good pharmacy practice or good manufacturing practice. So guys, we have a lot to learn. Make sure you stay on meds for clarity, not confusion, one med at a time. See you on the next one.